Welcome to the latest Google Hangout by the National Cancer Institute. My name is Cynthia Vitelli, and I'm the Associate Director for Public Affairs at NCI. I welcome you to what promises to be an interesting discussion about how you can submit your cancer research ideas to the National Cancer Moonshot Blue Ribbon Panel. As many of you know, we've had a lot of excitement over the past several months since the President announced the National Cancer Moonshot Initiative in his State of the Union address in January. He immediately put Vice President Biden in charge of this effort, and we've been gaining momentum ever since. Recently, the NCI announced the Blue Ribbon Panel that will play an instrumental role in the scientific leadership of this initiative. The Blue Ribbon Panel is seeking ideas for preventing, detecting, and treating cancer, as well as basic research and survivorship. We will remind you throughout the Hangout to submit your ideas to cancerresearchideas.cancer.gov. Again, that URL is cancerresearchideas.cancer.gov. I will start by introducing the panelists and lead a brief discussion before taking questions from you on Twitter. If you would like to ask us questions during this Hangout, please use #CancerMoonshot. Again, that's #CancerMoonshot to submit your questions related to offering the ideas to the Blue Ribbon Panel for their consideration. I'm pleased today to be joined by two co-chairs of the Blue Ribbon Panel, as well as an additional member of the panel in his role as a cancer advocate. I will introduce each one at a time and let them tell you just a little bit about themselves. First, we have Dr. Dinah Singer, who is the Acting Deputy Director for NCI and also the Director of NCI's Division of Cancer Biology. Dr. Singer?
Thanks, Cynthia, for sponsoring this Google Hangout and for inviting us to be able to tell everybody about the Blue Ribbon Panel. As Cynthia told you, I am the Director of the Division of Cancer Biology, which has the responsibility of managing a large grant portfolio in basic cancer research. I'm also a molecular biologist with an active research program here at the NCI in transcriptional regulation. But most recently, I'm now a co-chair of the Blue Ribbon Panel with Liz Jaffe, who you'll meet in a minute, and with Tyler Jacks. And I'm looking forward to being able to tell you about the activities of that panel.
Thank you, Dr. Singer. Next, I would like to introduce another co-chair of the Blue Ribbon Panel, Dr. Elizabeth Jaffee of the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins University. Dr. Jaffe?
Thank you, Cynthia. Hi, I'm Liz Jaffe, and I'm the Deputy Director of the Sidney Kimmel Cancer Center at Johns Hopkins. I'm also a member of the National Cancer Advisory Board at the NCI, and I'm a medical oncologist by training, and I'm an expert in cancer immunology, and I am co-chairing this committee with both Dr. Dinah Singer and Dr. Tyler Jacks.
Thank you. And then we have Mr. David Arens, who is the Chief Executive Officer of the National Brain Tumor Society. Mr. Arens?
Thank you, Cynthia. Hi, everyone. In my role, I'm currently the chair of the National Cancer Institute's National Council of Research Advocates. We're a federal advisory committee of patient advocates and research advocates that help the director of the NCI be responsive to the advocacy community and to help bring a patient advocacy voice to the NCI. With my other hat, I'm the CEO of a National Brain Tumor Society, which is a cancer patient advocacy organization on behalf of the brain tumor community, one of the major areas of cancer. And so very pleased to be part of this and very much looking forward to this conversation today.
Great. Thank you all for coming today. Before we get to your questions, and a few questions that I actually have for you, I need to do a brief virtual housekeeping, so to speak, on submitting your ideas and comments to cancerresearchideas.cancer.gov. The ideas and comments submitted to the website reflect the views of the author and not the views of the National Cancer Institute, the National Institutes of Health, the Department of Health and Human Services, nor the federal government. Please remember that your posts are public and your comments as well, so please do not provide any personal information such as email addresses. And finally, Please keep in mind this platform is not a solicitation for grant proposals, but a solicitation for ideas and comments on the scientific opportunities for the National Cancer Moonshot Initiative. Okay, let's get started. Dr. Singer, I'm going to give you the first question. Can you give us an overview of the Blue Ribbon Panel and how it will inform the President's Cancer Initiative?
Sure, happy to. Let me start by putting the Blue Ribbon Panel in the context of the broader initiative. For those of you who listened to the President's State of the Union address back in January, you probably remember when he turned around to look at Vice President Biden and announce a moonshot for cancer to really accelerate our understanding of cancer. As a result of that announcement, a task force was established of which Vice President Biden is the chair. The task force consists of the agency heads of about 13 or 14 different federal agencies, and its job really is to look across the entire spectrum of cancer, both cancer research, healthcare delivery, access to care, and policies that might be affecting our ability to effectively treat cancer. One of the components of the task force is the Blue Ribbon Panel, which is charged with really identifying the scientific opportunities that could be accelerated by the support through the Cancer Moonshot Initiative. Ideas, the science that is identified through the Blue Ribbon Panel will then be transferred up to the task force through the NCI for implementation.
Great, thank you for that overview. Dr. Jaffe, as another co-chair of the Blue Ribbon Panel, I heard Dr. Singer mention that the areas of scientific opportunities is what the Blue Ribbon Panel will be looking at. Can you explain the main areas of focus and how those areas were identified?
Yes, so the Blue Ribbon Panel had discussed what are the important barriers and opportunities that we need to address in order to be able to accelerate the development of new therapies and also ways to prevent cancer so that we can really impact patients more rapidly and help make their lives, improve their lives when they do get cancer. And so 7 areas were identified by the group. And these were 7 areas that we've established working groups. The first is on enhancing clinical trials. The second is enhancing data sharing. The third one is immunology, immunotherapy, and immunoprevention. So looking at both treatment with the immune system as well as preventing cancer with the immune system. A fourth one is implementation science. A fifth one is pediatric oncology, and we felt that this should be a separate category because pediatric cancers biologically are very different from adult cancers, and these cancers have not received the attention that adult cancers have received in the past. Precision prevention and early detection or early diagnosis and detection is another area. And then the final area is tumor evolution and progression, which would include metastasis. So we've established these 7 areas of priority, and we've established 7 working groups that have about 10 to 12 experts per working group to help come up with recommendations.
Okay. Thank you for that overview. Mr. Arens, I know that you are a member of the Expanding Clinical Trials Working Group, and is there anything that you'd like to add about how the working groups are going so far? I believe you just got started this week with your first meetings.
We did, Cynthia. We just had our first working group called Expanding Clinical Trials this week, and it was amazing to say the least. The group gelled very quickly. These are all senior scientists as well as myself as a patient advocate, and there's another patient advocate, Ellen Siegel, who participates. But very quickly we got down to business in terms of talking about what is going to improve and strengthen clinical trials to make sure the evaluation of new medicines is getting better so that we can find new and stronger treatments that work for cancer patients. But the sort of secret sauce in the conversation was the realization that it comes back down to the patient, that as phenomenal as the researchers are and as phenomenal as the research is, what's really going to accelerate cancer research is far more robust engagement by patients in the research process, and by getting more and more Americans engaged in the research process through donating tissue and being involved in clinical research. And that's just going to have to happen if we're going to achieve that moonshot effect.
So David, as a follow-up to that, mentioning advocates, during this Blue Ribbon panel time period for soliciting ideas on the scientific areas, and also we talked about survivorship and basic research as well, how do you recommend to advocates that they get involved and stay engaged throughout this Moonshot initiative?
Well, certainly participating, weighing in, writing down your ideas and getting them to the website. They are, I know firsthand, they are being read every single day by the NCI staff, and then those ideas are being literally given to the working group members, so we can see what members of the public are writing in about. What are your ideas for accelerating cancer research? They're not being taken lightly. They're being taken significantly. They're a key part of this process. So the first line of advocacy is weighing in through the website, and also by contacting NCI staff, members of the Blue Ribbon panel. Everyone wants to hear your ideas, but the first line is writing down those ideas and getting them in to that centralized location. You should also know, as advocates, that all the working groups have to address other cross-cutting themes that are important to all the working groups, such as health disparities. Health disparities cross-cuts every area of cancer research, and is very important for advocates to know that we're considering that. We're considering data across the board, considering a variety of things that must come together to accelerate this, as well as public policy. While it is public policy issues are really for the task force overall to consider, there is no doubt that public policy issues are being flagged in these working groups, particularly in the working group that I was on. We started to name a number of public policy issues that are going to be essential for creating an enabling environment for cancer research to be accelerated in. And so advocates, if you have policy ideas, as Vice President Biden would say, this is the time to weigh in with everyone's ideas. It's a great time to advocate.
Great, and I'd also like to remind folks that to submit your ideas to cancerresearchideas.cancer.gov. But the nice thing about this platform is that all of the comments are public, or I'm sorry, all of the ideas are comment, and therefore others viewing those ideas also have the opportunity to comment and even take that idea potentially to the next level through their thoughts on top of what you've already posted. So it's a very engaging, interactive way to share your ideas. Dr. Singer, where is the Blue Ribbon Panel in its development of recommendations, and what is the timeline for folks to remember?
Yeah, so that's a great question. The timeline is actually very aggressive. The Blue Ribbon Panel is to have its report finished and submitted to the National Cancer Advisory Board by August. The Blue Ribbon Panel was named in the beginning of April 4th actually, and since then has met twice to identify those areas that need further investigation that Dr. Jaffe outlined. Those working groups were populated, and all of them by the end of this week will have met and have started to discuss what they think are the special opportunities that are poised to be accelerated through this initiative. Each working group has been asked to identify 2 to 3 recommendations that will then go forward to the Blue Ribbon Panel. The Blue Ribbon Panel is scheduled to meet next month to go over all of those recommendations. And as Mr. Arens alluded to, we expect that many of those recommendations will in fact be cross-cutting, overlap a number of different working groups. And what we're hoping is that we can synthesize those recommendations in ways that are synergistic to really give rise to very powerful, aspirational recommendations that really can be accomplished within a 5-year time frame. Our charge has been to identify those initiatives that can be accelerated from a decade to 5 years and be accomplished in a really rapid time frame. And that's what we're striving very hard to do, is to identify those recommendations. Ultimately, the Blue Ribbon Panel will have 5 to 10 overarching recommendations that will go forward through the NCI to the task force for implementation.
Great. So the cancerresearchideas.cancer.gov platform for submitting ideas opened on April 15th. As Dr. Singer mentioned, the Blue Ribbon Panel just got together on April 4th, so we opened it almost immediately following. And as of Monday, May 9th, just yesterday, there have been more than 120 ideas submitted, and on those 120 ideas, 70 additional comments. So I'd like to ask Dr. Jaffe, you are the chair actually of the Immunotherapy and Immunoprevention Working Group. What are your thoughts on some of the ideas and comments that you guys have been reviewing?
So I believe we've been receiving some very important thoughts and ideas for this. One big thought, which has been circulating in the community for a while, but it's ready to go, but really does need to be resourced well, is something we're calling the Immune Atlas. And the Immune Atlas, what that really entails is trying to basically dissect the immune environment that is within not only cancers, but also in the pre-malignant lesions. So we now know that cancer is it's not as simple a process as a series of genetic changes, if you call that simple. That's not really so simple. But we know that cancers develop as a result of multiple genetic and other types of changes, including immune changes. And the immune system that gets into the cancer can sometimes help the cancer grow instead of prevent it from growing. And the reason is that the cancer changes the function of those immune cells that are getting in to become more cancer promoting. And so the idea would be to figure out what are the earliest and then progressive changes that occur within the immune component of the cancer, so that once we know what those signals are, we can develop drugs and approaches, immune-based approaches, that can alter that. So I believe that that is one of the areas that the group will pursue. Again, this is what we're learning from the website, what I'm hearing from many of my colleagues as a high priority area for pursuing.
Very impressive. Thank you for sharing that level of specificity. I think that helps to give our audience an idea of the richness of the scientific thought that you're looking for when folks are submitting those ideas. And then, David, I'm going to throw it back to you. We already mentioned that you're on the Expanding Clinical Trials Working Group, and I know that just yesterday, as you mentioned, you had a really great discussion. Are there any specific ideas or thoughts that you have on ideas that have been brought to the working group that you've been discussing that you either think are promising or you'd like to highlight as a good example of what folks should be submitting?
Sure. We focused a lot on how do we get more patients involved in clinical trials? How do we make sure that we're reducing or actually increasing the incentives for community-based hospitals to get patients enrolled in clinical trials, even if they, in their own hospitals, do not have a particular clinical trial. And so, given that most cancer patients are not able to go to an NCI-designated cancer hospital, how do we make sure that that fact alone is not a deterrent from patients enrolling in clinical research if they feel it's that their doctor thinks is best for their treatment? And so how do we create a nationwide tapestry of centers that are where it's much easier to get involved in clinical trials if it's the right thing for the patient, and coming up with a much bolder system for getting patients engaged in clinical research was one of the ideas we were talking about yesterday. And it's also an idea that's been talked about in the ideas submitted through the website. So it was an example of how the working group and then people submitting ideas on the website are actually coming together.
Great. Before we start taking some questions on Twitter, can you guys hear me okay?
We're getting a lot of feedback.
I just wanted to ask Dr. Singh if there's anything else that she would like to add as an overview of the Cancer Research Ideas.cancer.gov submission process that we haven't touched on so far.
I think David did a really good, and Liz did really good jobs of describing how we're using those ideas. As David mentioned, we read them every day. They're actually downloaded every week and sent to the different working groups. They're also posted on a wiki site that is available to all of the Blue Ribbon panel. But I would urge people who have ideas to please submit them by July 1st. As I mentioned, we have a very aggressive timeline, and in order for your ideas really to be incorporated into our thinking, we need to have them posted by July 1st. And we are reading them, so please do submit them.
Okay, it seems like we're getting a little bit of feedback, so folks could mute their speakers. That might be helpful in not getting the feedback. All right, but I did hear from Dr. Singer July 1 is our deadline, so we want to keep that in mind. Okay, so let's move to some Twitter questions. I know that we have many scientists, advocates, members of the public here to provide input. And if you'd like to ask questions relevant to this Google Hangout, please use hashtag #CancerMoonshot. Okay, so let's go to our first question. We have Alex via Google Plus, and her question is, what types of technology will best support this initiative, particularly from a data and computational perspective? Were you able to hear the question?
There's a lot of feedback, Cynthia. Could you repeat the question?
Sure. I'll say it very slowly. What types of technology will best support this initiative, particularly from a data and computational perspective?
So we've been talking about technology across the board in all of the working groups. We need to develop new technology in terms of detection for actually diagnosis and for therapy. In the clinical trials working group yesterday, there was a discussion of novel technologies that would allow an immediate assessment of a patient's response to therapy. Certainly in the area of data sharing, computation, we need to develop new algorithms to be able to assess cancer as a system, as a network of interactions. So the data sharing working group is going to be addressing many of the questions of what kinds of computation are needed and what kinds of technologies, and how do we share data in an interoperable fashion across the broad spectrum of researchers.
I think we're going to have to pause just for a minute because I do not believe our audience is able to hear the responses at this time. So let's just give it a minute for our technical folks to see if they can fix the feedback. David, do you think that you could try to use earbuds? Do you have them handy?
Yes.
I don't know why it started halfway through. Okay, I'm just going to mention the hashtag one more time. It's hashtag Cancer Moonshot. And as soon as we get the feedback fixed, we'll start taking those questions again. Okay. Can you hear us, David?
Yes.
That seems to have fixed it. Great.
Okay.
All right. Thank you, audience members, for being patient. We're going to go then to, let's see, what's our next one? We also have Waleed, who asked us via Google+, how can we ensure that the benefits from the Cancer Moonshot Initiative will extend to minorities and marginalized communities? David, would you like to take that?
Sure. All of the working groups, for example, are thinking about health disparities and thinking about ways that all of the cancer research and across all those themes address health disparities, including minorities. So, for example, I'm sure even in clinical trials, we'll be talking about clinical trial design and ways that clinical trials of the future will be enriched to make sure that minorities and are represented in those clinical trials, to make sure that clinical trials evolution are robust and capture not only are able to address not only the heterogeneity of the tumor, but the heterogeneity of America. And that's really what we're trying to make sure, is that cancer research doesn't discriminate. Any American could get cancer at any time. And so in population sciences, that working group, or even tumor biology, issues affecting all Americans are here. And like we said earlier, policy issues are going to come up to make sure that that everyone has access to cancer care, that everyone has cancer treatment, and even cancer treatment that is related to research is reimbursed. Those things also address health disparities and are very important for minorities as well as any segment of the population. So cancer is truly one of those things that hits everybody, and so access to it and the quality of care are traditionally the issues where health disparities really come into play. But they also come into play in research, and I think all of these working groups have that front in mind based on the conversations that I've been in.
Great. Well, I think that leads perfectly into a question that we're getting from David in Boston. And Dr. Jaffe, I'm going to ask you to field this question. He really wants to know, will all stakeholders really collaborate in such a competitive space? What are your thoughts?
So I think that's a great question. I think that the answer is that is part of our mission. I think the Vice President made it clear that he wants us to remove any silos and barriers to being able to collaborate between institutions, between groups. And I think there really is good buy-in in the community with the right mechanisms to really stimulate collaborative research. And we already have examples through program grants at the National Cancer Institute, SPORE grants, Stand Up to Cancer grants that are national. So I do believe that we are able to, we are motivated to do it, and with the right mechanisms, which I think this Moonshot will provide, this will happen.
Great. Great. Dr. Singer, I'm going to give the next question to you. Let's see. Pamela says that she is very glad that the Moonshot will focus on pediatric cancers, but asks how the Moonshot will address adolescent and young adult cancers.
That was actually a specific topic that we've raised a couple of times. The young adult cancers, adolescent and young adult cancers, we now recognize are distinct from both pediatric cancers and adult cancers. And the working group is going to discuss whether there are specific research opportunities that will focus on that spectrum of the population. So they haven't been forgotten. We're very well aware of it. We're well aware of the distinctions, and that is a topic that we will be talking about.
Mm-hmm. And Dr. Singer, another question for you. Let's see. We have a question from Rodney asking about funding opportunities and if funds are going to be available for small business interests, or is the money going to go to the same big players that is perceived that always does? Can you talk a little bit about new funding opportunities that might be available?
Sure, I'd be glad to. So as Liz mentioned, one of the big motivations here is to develop collaborations. What I didn't mention earlier is that the Blue Ribbon Panel, as well as all of the working groups, have representatives from across a broad spectrum. Not just cancer researchers, we have representatives from the private sector. We have representatives on every working group from the advocacy community, as David can tell you. And so there's a real commitment to collaborate across all of those. And therefore, as we develop whatever funding opportunities come out of the recommendations, we expect that we will use some of our traditional mechanisms. We expect we will be developing new mechanisms, and we fully expect that small business grants, SBIR, STTRs, will be among those that will be used to implement all of the recommendations that are coming out of the Blue Ribbon Panel.
Great. I think we just have time for one or two more questions before we have to wrap this up. So, David, I think this might be a good one for you. Sabah asks, are CROs, clinical research organizations, involved in any of the working groups, especially since they carry out such a large percentage of the clinical trials around the world?
You know, I'm not sure whether we have CROs, specifically members of CRO organizations specifically represented on the working groups, but definitely the people on the working groups work with CROs every day. You know, I think of just in the imaging world alone, probably you know, anyone who works in clinical trials is relying upon CROs for imaging, for example. And so I don't know of any particular CRO companies that are literally named on the working groups or panels, but I'm sure we're all drawing upon CRO experience because it's invaluable to advancing cancer research. CROs they're a critical and essential part of advancing particularly clinical cancer research. And so if any CRO has ideas, I think every working group would welcome them to submit ideas to the website because they're key partners.
Great, thank you. I think we're going to go ahead and take the last question, and Dr. Singer, I think this would be most appropriate for you. We had several questions come in about this topic, but specifically one from Michael, asking how this National Cancer Moonshot effort is working with other initiatives, you know, such as the Cancer Genome Atlas, other major initiatives that NCI has been conducting over the years. How does this fit into the bigger piece of the picture?
So a number of the cancer initiatives are complementary to what we're doing here, and I should note that the NCI is going to continue to support a large spectrum of cancer research with our appropriated budget. What we're talking about for the Cancer Moonshot really is to support really exceptional opportunities that are positioned to really move forward with a quantum leap that is going to benefit from the funds and the support that will be forthcoming from the Moonshot. So initiatives that we have within the Institute are going to inform the kinds of recommendations that will come out of the Blue Ribbon Panel. We're also very aware of initiatives that are ongoing in other venues, some of the new foundations, and we're being very cognizant of wanting to complement what everybody is doing so that we have the whole is greater than the sum of the parts in terms of what we're attempting to achieve here.
Wow, that was a great way to put it, and I think we're going to end there. The sum is greater than the whole of its parts. That's fantastic. Well, that's all the time that we have for today. I want to thank Mr. Arens, Dr. Jaffe, and Dr. Singer for spending the time with us. We hope that you enjoyed the Hangout. We also want you to know that shortly after this wraps up, we'll have the entire video available on NCI's YouTube channel. And also want you to remember a couple of important dates. July 1 is when all of the ideas and comments that you want to post to cancer research ideas.cancer.gov should be posted and commented on. That the working groups will be working diligently, meeting weekly through June, and so that the NCAB can produce its final report up to the acting director, Dr. Douglas Lowy, at the NCI by late summer, early fall. So keep those ideas coming. We only have a few more weeks to get them in, and I just want to thank everyone for their time.
Thank you.
Thank you.
Good afternoon.
Thank you.
Afternoon.